We are kicking off Breast Cancer Awareness Month with Dr. Knudsen, the CEO of the American Cancer Society and ACSCAN. Welcome back. It's great to have you here. So we want to talk about prevention, screening, and treatment right now. Let's start with screening. What are the latest guidelines?
Yeah, so important. And there's much science behind this. So it's important to know screening guidelines are for women of average risk. What does that mean? Starting age 40, have that discussion with your physician about the right screening plan for you. All women should start their annual screening at age 45. After age 55, women have an option to stay with that annual screening or to go to every other year until they have less than 10 years to live. So even beyond age 75, if a woman has an expectation to live another 10 years, she should still get screened.
What about younger women who don't qualify for a mammogram?
Yeah, well, it's important to understand that there is a rise in breast cancer in the younger population. They may be below this 40. So if there's something that seems amiss, you must be screened. But also important to know who is not of average risk, because risk is more than just about your age. It's your genetics, your family history, your own medical health exposures. So those are the conversations to have as soon as possible with your doctor to understand what's the right screening plan for you.
And there really have been advancements in screening and advancements in treatment.
Absolutely, and that's what's driving down this 44% reduction in breast cancer mortality that we reported on earlier today. Mammograms are not what they used to be. We used to be at 2-dimensional, now we're at 3-dimensional, much more effective for women whose breasts are difficult to image, like women who have dense breasts who are at higher risk for breast cancer. Treatments have also improved. I'm old enough to remember when breast cancer was one disease. Now we know it's many subgroups that all arise due to different reasons and have to be treated with different therapies.
So many of us learned for the first time about what is called preventive chemotherapy after Princess Kate made her announcement. Explain what's going on there.
This is so incredibly important. There are thousands of women across the country every year who go to mammography and they don't have breast cancer, but they're identified as having a high-risk lesion, or maybe they have a genetic risk of breast cancer. They can go on chemo prevention. The studies are quite clear for a large subgroup of these women. They can go on what is a low dose of tamoxifen or estrogen receptor-related therapies that can significantly reduce their cancer risk. So beyond just the things that you can do in your healthy living to reduce breast cancer risk, chemo prevention is real for breast cancer.
And where do things stand on a breast cancer vaccine?
Yeah, so vaccination against cancer is something not new to the cancer field. We know that we can effectively prevent many cancers through vaccination. For example, through vaccination against the human papillomavirus, for which we have the opportunity to eliminate, for example, cervical cancer. So there's much now in clinical testing and as well in development for vaccinations that can help with breast cancer prevention as well as therapeutic intervention. More to come.
That's so important to hear. And we have a great group of thrivers and survivors and caregivers here in the studio. We're going to be taking more questions from them later. But what's your most important message to everyone here?
Yeah, I think the most important message is that there is more hope than ever before because of early detection, because of what we know we can do with prevention, and because of advances in therapeutic intervention. So more to come, but certainly more hope than ever before.